Hey, Margie here. Wouldn't it be nice if there was another alternative to high intensity resistance training? We know that's so wonderful for our bones, but for many people, that's just not something they can do. Well, the good news is that there is, and it's called blood flow restriction training, also known as BFR. And so today I really had to find the right person who is both someone that's I really wanted a physical therapist who's worked with both blood flow restriction training and is also has an expertise in osteoporosis. And I found the right person, Dr. Gina Panarese. She's a physical therapist with a specialty in bone health and osteoporosis. She's board certified clinical specialist in orthopedic physical therapy. And she also is certified in blood flow restriction. And Gina has her clinical practice at Kessler Rehabilitation Center in Morris Plains, New Jersey, and is a faculty member of their orthopedic residency program. So in today's talk, we're going to talk about blood flow restriction, what it is and how it can be used for strength training and to help with osteoporosis and osteopenia. Welcome, Gina. I'm really excited to have you on the podcast. This is a topic that most people have no idea about, but yet I think it has so much potential and it can really just help so many of the people listening. So thanks so much for being here.
Thank you for having me. Pleasure to be here. This topic is very interesting and the research is becoming way more popular on it. So I'm happy to be here.
You know, I always like to hear the backstory, how you got to do what you do. And so I know you specialize, one of your specialties is bone health and osteoporosis. So how did you decide to go into that, or how did that evolve?
Yeah, so it all started, my interest first became with female athlete triad and bone health within that population. And our company offers special interest groups within multiple populations within our field, and bone health was one of them. So I joined our special interest group in bone health about 6 years ago, and then learned more about bone health in general, osteoporosis, and more than just the female athlete triad, and then took more courses and then became bone fit trained through now what's called the Bone Health and Osteoporosis Foundation.
Fabulous. So now let's go to what we're talking about, blood flow restriction, because most people, that just sounds like such a crazy, blood flow restriction training. It sounds awful. The name is so scary, but yet it's just the opposite of anything because it can help the people who really can't do a lot of exercise. So why don't you just tell us what it is, first of all?
Sure. So there definitely is growing evidence to support the use of blood flow restriction training, or BFR, in rehab. So what it is, it involves decreasing blood flow to a muscle by application of a wrapping device like a cuff or any kind of specially designed cuff or strap while exercising at a lower intensity. So what the mechanism is, it reduces the amount of arterial blood flow, which may possibly create a hypoxic environment, and it occludes venous return. So this results in pooling of blood and metabolic byproducts, which is thought. So essentially creates an artificial high intensity environment. You can train at lower levels and get similar benefits of high intensity training, such as increased muscle mass, strength, and now studies are becoming more popular with how it can improve bone mineral density.
What's so amazing to me, and I think so exciting, is that because a lot of people can't do the high intensity training that's necessary, that they've really been shown in the research to improve bone density and to make, have this big impact. But this, you can do lower intensity training, just like you said, and still get the same result. That's what's, or a very good result. That's what's crazy, because we can sort of, it's sort of a biohack, right? That we can, you sort of fool the system in a sense. So how has it been used? How did you get started using it in the clinic?
So there's different ways it can be used. So it could be used alone, and that would just help attenuate atrophy, or with electrical stimulation, which also would help attenuate atrophy, increase strength. This is great for people who are immobilized, like post-op. So I've been using it on post-op ACL patients, for example, or just people in general who can't tolerate a higher intensity exercise to get those benefits. You can also use it with aerobic exercise. This will help increase your strength and aerobic capacity, studies show, or with resistance training, as it's starting to be used for bone health. Studies are still, we're still in the early stages of research, but it's showing some benefits to bone health.
It's interesting because years ago I took a continuing education physical therapy course, and it was really talking about using it for knee rehab and athletes and different things. And in my head, I'm thinking, wow, this could be such a great thing for osteoporosis. And I remember asking, and they said, oh, that sounds really good, but it's really not being used for that. But the fascinating thing is in the research, it actually affected the bone markers, which is
Mhm.
so exciting. And so I just think this has so much value and really can be just a wonderful tool. And so first of all, well, tell us, is it safe? Because people are thinking, oh my God, I'm occluding blood flow. Is there any dangers to it at all?
Right. So there are thoughts about including blood flow and if it affects either blood clots or the thrombolytic effect. But most studies have shown that it is safe. But the problem is there's no one intensity of pressure that's standardized. So that creates a problem in the research. But I was certified through smart cuffs for BFR training. And the research shown through there shows it enhances anti-clot potential, shows no changes in nerve conduction velocity, increase in vasodilation over time, and compared to just high intensity exercise in general, there's a less increase in heart rate, blood pressure, and cardiac output. Of course, there are precautions and contraindications like any tool or modality. You want to be careful with people who have poor circulatory systems. If they have high blood pressure, you want to monitor that. And some, not all contraindications are people who have excessive swelling, if they have acidosis, if they do have a history of blood clot or on medications that could cause blood clots, if they had, a dialysis port in that extremity, or if they had a mastectomy in that same extremity, lymphedema, open wounds, if you're pregnant, these are just some of the contraindications that you wouldn't want to use this on. But for the general healthy population, it's been found to be safe in the current research.
I'm even thinking that a person who has arthritis or has, pain, like a lot of people have pain, and that's what doesn't allow them to really partake in the exercise program they would like to. So would that make sense to you that those type of patients, this would be a wonderful adjunct to?
Absolutely, because the research is showing its similar benefits to high intensity training. You're still going to get the strength gains and muscle hypertrophy without having to go to that extreme load that you can't tolerate. There are some studies to show that low intensity training to failure can also help strength, but its studies are very limited. It doesn't really seem to affect bone mineral density or bone health, even if you're going to failure. And it's a lot easier if you were to put the BFR cuff on and not have to go to failure. It's less time, less effort, so an overall better experience.
And when you've been working with people, what have you seen in terms of their response to it? Is it something that you work with them and then they do it at home, or how does a typical session work with this?
So we have the smart cuffs tools here. So there is an option in
It's just
some
a cuff.
clinics.
Explain what it is. It's just a cuff, right?
Yeah, it's just a cuff. It's a thick cuff, and there's different sizes to fit different size limbs because you can use it on your upper or lower extremity. And what we do is we would find your limb occlusive pressure, or the max amount of pressure that your limb can be occluded at, and that we use a Doppler to find that. And then we would put it on the limb. And then usually for resistance training, our protocol using the smart cuffs is to start with 40 to 50% of that limb occlusive pressure, and for lower extremity to go from a 60 to 80. So you would start low and then to tolerance, keep increasing that. And I've tried it myself as well as some of my patients, and you really feel fatigued. The protocol is you would do 30 reps and then 3 sets of 15 reps, and you really feel the fatigue by the end of that. So it's pretty awesome to see those immediate benefits.
Even at a much lower rate than a
Right.
much lower weight than you would normally be able to
Or body
tolerate.
weight exercises in general.
Yeah. Yeah. And that's what's so great with, a lot of the osteoporosis exercises are body weight. So people would just put the cuff on and then do their exercise program with the cuff. Now, do they afterwards take these home?
So we don't have that option in our facilities, but I have heard of different companies that you can order like a rental and use it at home as well. So it just depends on the type of company and the type of cuff that you're using.
And how long would a typical, so someone's listening and they're saying, oh, I have problems. I can't use high weights for whatever reason. And let's say they have osteoporosis. So if they went to, they'd have to find a physical therapist who has training in this, number one, right? Because we want to do this as safe as possible. Because I know a lot of gyms, I mean, there's a lot of personal trainers who also do it, and you could even buy the cuffs and do them at home. So in your mind, what is the absolute safest way to do it?
Definitely to find someone who's trained in it, because especially there's a lot of different cuffs out there or even straps, and it's not standardized. So it's a lot harder to know what percentage of your limb you're occluding and things like that. So I would say it's definitely best to find someone who's certified and does it in an organized fashion.
And how long do you typically work with someone on this?
So usually it depends on the case. Usually want to start with like 1 to 2 exercises, 2 to 3 times a week, and then gradually increase. You're not going to really do more than 4 or 5 exercises in one session. And that's over a span of a few weeks.
That's great. Yeah, I just think this is, to me, when I heard about this, I was like, oh my gosh, it's such a, because so many people just could not do the high intensity training that we want to do for our bones. And that's, you want to talk about that research study, though, what it showed? Because I think that's interesting that it showed similar effects.
Right. So typically exercise improve bone health or osteogenic or high intensity, quick multi-directional movements or a period of time. So the load has to be higher than what your bone cells are exposed to in their daily loading environment. But as we spoke about, most people with osteoporosis, high impact exercise is contraindicated or they can't tolerate it. So a lot of these studies showed BFR with low intensity compared to high intensity resistance training. And they found similar improvements in strength, and the bone formation markers have shown to be also improved. It's hypothesized that the main mechanism behind this is it increases intramedullary pressure and interstitial fluid within the bone caused by the venous occlusion. So it's kind of like, is it something that's more local or can it be systemic? There are studies that show that there is a systemic effect to the blood flow restriction training. And with a lot of these studies, they measured the bone formation markers through blood samples that you would imagine would be more of a systemic improvement. And then also when you're putting on the actual limb, there is that more specific effect on that actual limb that'll have that effect on by improving the blood flow and the increases in interstitial fluid. So it's kind of like which is it really affecting, and it could be both, as what the studies have been showing. I have colleagues who also use it on people who've had stress fractures, mostly in like the tibia or even the metatarsals. So again, it's improving those bone markers, and that fluid release is what's creating that improved bone mineral density to help healing for fractures as well.
Yeah, I guess it would be hard to use on a vertebral fracture, though.
Right, but then also if you're thinking that it's improving the bone markers in general through blood samples, then it might be increasing systemically. I think there should be more studies. That's I think one of the limitations with these studies. It's not really targeting or being specific with, is it site specific or is it more systemic improvement? So that would be nice to see more studies that actually dive into that area too, because like you said, the spinal fractures are one of the main components of fractures with people who have osteoporosis. So you're already putting on the limb, so is it really going to affect the spine in that way? But the femur and your radius is also other sites that are more common in fractures with people with osteoporosis. So putting on the limb could help that improve as well, according to these studies.
Yeah, wouldn't that be interesting if you're trying to, increase your hip and or even if, following a fracture and you really can't do much, but then you put the bands on or the cuffs on and you can, have significant improvement in strength in a much quicker period of time and without the high intensity. So it's just to me, it's just so exciting. And I know in the state of New Jersey, some of the people who are involved with research are talking about that would be a good physical therapy project to really do some research studies because I just think it has so much potential. People don't really know about it. Athletes do, though. It is used. You want to just talk about some athletes use it just because they can gain more, not because they need to, they can do the high intensity. But you want to just talk about
Right.
that for a minute? Yeah.
Right. So it's definitely very popular in athletes and the NFL, all of the national sports, and even within our community, a lot of surgeons are even asking it to be used with their post-op ACLs and that kind of thing. So it's definitely more popular with that. Post-op, you could see because they can't tolerate the high intensity, but it's even great for people who can because then you don't have to lift as heavy weights or go as intense as you normally could. It takes less time to get to that failure than it normally would in your normal high intensity workout.
And what have you seen? Because you've been dealing with athletes and you've been dealing with these injuries before using this and then after. So what type of difference have you seen?
Yeah, I've definitely seen difference in their progression in rehab. It goes a little bit faster with the BFR that they're having more strength gains or even just like their quality of their movements are getting better when they start using the BFR. It definitely has an impact for sure. Less muscle atrophy, especially the quad, is a huge component post surgery. So it's pretty cool to see.
So since this is, again, there hasn't been that much research on it, but and you are an expert and really have done a lot of work with people with osteoporosis, where do you see this? Like what muscles, like where do you see that it would be, if you were creating like the best program using this, what would you see?
Yeah, I definitely can see it affecting the muscle of the hip and the arm, but I think the hip would be great, especially with increased fall risk. Another thing to think about is that, exercise improves strength and balance, therefore decreases fall risk. Medications are often prescribed to improve bone mineral density, but they don't affect fall risk at all. So all other components are just as important as improving bone mineral density. So if you're using the BFR to help strengthen, this will help improve balance as well. And studies have shown that too, that it helps balance. And strength is also a component of balance. So that's huge. And preventing falls and preventing fractures in general is our number one goal with patients with osteoporosis. So that's huge in that regard.
Yeah, that's so interesting that we could use this, just as an adjunct. And I'm wondering, the person who's so weak, because there are a lot of frail people and, they're just scared to lift anything. And it takes a very long time with strength training. So I'm just wondering if they get starting here, then can they progress to an even more intense program as their muscle strength improves? What's your thought on that? Like starting
Yeah,
here and then having the strength and the stability and the balance, then to even be able to move on your own without this.
yeah, I think that'd be a great way to get started, or even trying the cuffs without any exercise and just seeing the benefits of that. And studies show that that helps improve strength and decrease atrophy in general. And then slowly building their confidence to start doing body weight exercises with it and then progressing from there. I think that would be a great way to start a program for patients who can't really tolerate much exercise in general.
Yeah. So for everybody listening, if this sounds like you, where you want to do that strength training program and you want to do that higher intensity and you're limited, to me, this is just a real good, another possibility, just a great alternative that most people aren't aware of. So I guess, well, the good thing in New Jersey, people can just come in and they don't have to get the doctor's referral. They can just come in and work with the physical therapist.
Yeah, it's great. We have direct access in New Jersey, so you can come in without a doctor's script unless certain insurances require a doctor. So in that case, you would have to go see a doctor first. But what's great about my company where I work, we also have a Power Up Your Bones program. It was a 6-session program that, if you're at risk for osteoporosis or you have osteoporosis and you want to learn and go through, diet, exercise, just healthy bone techniques to use. And we go through 6 sessions of exercises and general information about osteoporosis and posture, prevention, balance. That's a great way to get started without having, a specific injury in general, just doing a healthy bones program. And it's a great way to gain information on the whole aspect itself.
So
And
I have
with
a
that,
question.
we also, go ahead.
Now, is that just your local, Kessler where you work, or is that Kessler the entire New Jersey?
It's the entire New Jersey, but only, the PTs who specialize in bone health will offer that program.
Got it.
And then
Yeah.
we have 2 components. We have a higher intensity and a lower intensity, depending on what the patient can tolerate.
So we know what we'll do. We'll have in the show notes all your contact information. So for anybody living in New Jersey, they can access this. You don't have an online program, anything like that, do you?
Not at this time, but that would be a great idea to do as well.
Yeah, no, it's all good. And so, yeah. So where do you see in terms of the future of this?
I definitely see more research being done, and definitely a start towards using it for bone health. I think it'd be a great way to introduce a different modality, especially, when things are difficult to get started.
Yeah, no, I just think it's so exciting. So I think an important piece, though, is that not every physical therapist who does the cuffs, there are a lot of probably orthopedic trained. I would say more often, it's not as though people who are trained like you, who have the training in osteoporosis, who specialize, which I think is really, maybe you can talk about that too, because not all physical therapists are not trained in really dealing properly. They just don't have the training in osteoporosis working.
Mm-hmm.
So a lot of the people who are doing the cuffs are more orthopedic physical therapists, and they may not really know the best exercises. So they just all have to come to you, Gina.
I'll be very busy moving forward.
So yeah, so it's that would be interesting. So I guess they'd have to go to a facility and I think more and more physical therapists are getting trained in this. I really do. I know that I did an online class during COVID, and I really wanted to do a more in-person one. But I see it all over the place now, and I just think it's becoming, because it works. It works, and I think it's such a wonderful modality. So I guess do you have any suggestions when they're going to a physical therapy or when they're trying to figure out who to go to?
Yeah, I would definitely, if you're interested in a BFR, I would call and just see if they were certified in BFR in the facility. And for someone who specializes in bone health, if that's what you're looking for in that scope of practice. But if you're just looking for the BFR, I would just see if that facility is certified. And like you said, it's becoming more popular these days. So more and more clinics are going to have the devices. And, I'm lucky in my company, we do offer these special interest groups. So I was able to do more research and take more classes in the bone health and osteoporosis population.
Great. So from your background, what have you been seeing with people who have osteoporosis and exercise, since you've been doing it for quite a while? Have you have some good results to report?
Yeah, I've seen a whole spectrum of different types of patients, from more on the frail side to more the more healthy, higher intensity people who already have an exercise program. And it's interesting, a lot of people are not aware of the postures and positions that you want to avoid, or the best exercises. A common thing I see a lot is people who are more active and they do a lot of yoga and Pilates. And there are a lot of exercises within those 2 fields that you want to avoid or modify if you do have osteopenia or osteoporosis. So it's a lot of, I feel like there needs to be more education on that type of thing for sure.
It's so true. And the good news, though, is there's so much that can be done. I mean, that's why, to me, do you see this as well? Like couch potatoes, and they're forced into exercise because they get this result on their DEXA scan, and then they've never felt better in their life.
Exactly. And I've had coworkers who have had a diagnosis of osteopenia who started doing some of the program exercises, and on their next DEXA scan, their bone mineral density improved. So it goes a long way. I think it's a great supplement, to other forms of treatment as well.
That's great. So tell us a little bit more about Bone Fit and the training program.
Yeah, so I took an online course through the now it was called the National Osteoporosis Foundation. Now it's called Bone Health and Osteoporosis Foundation. And it was a weekend course that went through, just generals about osteoporosis. And then we went through safe exercises and then ways to modify different exercises as we discussed through yoga and Pilates or just general exercises. And the more, up-to-date research on the postures and avoiding, the forced end range flexion and rotation or weighted movements like that. So it's pretty informative. We were able to practice, some of the exercises. It used a lot of the Sarah Meeks realignment routine that was like the basis of the exercise program, which is pretty cool because her program I think is great. I use it a lot and have seen great benefits with posture and balance and all that. So it's pretty great.
Yeah, no, Sarah's been on the podcast. I know Sarah actually pretty well. And it's something I think what she brings to the table that so often is missing is the alignment. People, the sad thing, and tell me if you see this as well, because I would see all the time, people are online and they're just doing, they're doing the exercises that someone told them are good or that can help bones, but yet they're doing it in a position that really can negatively affect their posture and just so many other joints. And so on one sense where they may be helping themselves, they can actually be increasing the risk of fractures. Have you seen that as well?
Yes, I feel like I see that all the time. And again, like we said, I feel like there's not just enough awareness about posture and positioning and alignment. It goes a very long way in your daily routine to keep good posture and alignment.
And I think that's why my suggestion for everybody is if you can see a physical therapist, if you have a diagnosis of osteoporosis, osteopenia, it's usually covered by insurance. See a physical therapist. Don't try to do it on yourself. Don't try to do it by yourself because it's hard to know. It's hard to know if you're in good alignment. Sometimes you think you're in good alignment, then you see a picture of yourself or, oh my gosh. But yet when you're with a physical therapist, they can look and see exactly if you're doing it properly. And I just, in the gym, it's so hard for me not to say something like, not to walk around like, did you know you are in the worst? Do you find the same thing? I just want to like take half the people there. Like, wait, what are you doing? They're
Yes.
doing these exercises in the worst posture. And I'm thinking, oh my gosh, I just see like neck injuries or and I realize, unfortunately, I don't really have that. No one's asked for my opinion, but can you relate to this?
I can relate to that. Sometimes you have to put the blinders on and just do your thing and try your best to not see it, but it's
Yeah,
very, very common.
I think it's a problem when you're a physical therapist. You sort of see the world, you're so in tune to posture and alignment, and we know how important that is. And then when we see someone totally out of alignment, we're thinking, oh gosh, we know exactly what to do to help them. And they're doing the worst thing. Again, if it's a friend, I'll say something or somebody, but in the health club, I would say at least 25% of people are doing things that I think are causing more harm than good. And it's really bad though when you do, because that's the problem. You don't know who to trust. And I think that's an issue. Do you see that with people having like embarking on the wrong exercise program with people that they trusted, not meaning to cause harm?
Absolutely. And there's just so many different opinions out there that sometimes it could be hard to get the right information.
Yeah. Because so often, you'll go to the health club. This is how I got started actually in osteoporosis, where I started seeing a group of doctors. Now we're talking over 25 years ago. So this is a long time ago. We're sending me patients and they asked if they could send patients. I was working in orthopedics, outpatient orthopedics with osteoporosis. And they were all doing things really increasing the risk of fractures because they just didn't know where to turn. And I thought that was so sad. And that's when I thought, oh gosh, I really have to get involved. And, it's sad that we still see this, that we still
Right.
see it's not known and it's not, I think that's a sad situation. But the good news is there's lots of physical therapists, and there's lots of physical therapists like you who are doing, wonderful things and have the background. And so that's, you just need to, that's another thing though. People can, who have that training. So if they're asking for physical therapists who have experience in osteoporosis, if they have the Bone Fit training, which is originally from Canada, if they have the Bone
Mhm.
Fit training, which is a wonderful program, then they know that this person has a background. And I think facilities will usually say, they're not going to just tell you someone has experience with
Right. Or
osteoporosis.
you can have experience and not be bone fit trained, or
Exactly.
you can go on their website and it will list people in your area who are bone fit trained after they go through the courses.
Oh, so it's just if they go to Bone Fit, what's the website? Do you know if
The National Osteoporosis Foundation or Bone
Oh,
Health and
okay.
Osteoporosis Foundation, they'll have a list of clinicians on their website who are bone fit trained, and if they agree to be listed on their website.
Oh, I didn't realize that. That's fantastic. I
Yeah,
love that they changed the name. So it's
yeah, it's
not
great,
just
right?
the osteoporosis, because bone health is so important, all ages, and all the things we're talking about apply to, people of all ages. So I
Mhm.
think that's really so much more inclusive to really, to just focus on bone health at all ages instead of
Definitely,
just,
it's an investment early in life to get the benefits later in life, for
yeah,
sure.
exactly. So if you had, from your experience, what would your advice? So first of all, we know about now the band. So we're definitely going to have this in our back pocket as another tool. And I will keep everybody updated as well on what happens. But I just wanted to put it out there, because if this sounds like that you can't do this high intensity and you can only use, because the problem is if you're just using 2 pounds, it's not right. You want to tell us the problem that, people think, oh, I'm lifting 2 pounds. This is great. That's all I need to do. What's the problem with that?
Right. If you're not going to failure, you're really not going to see any benefits at all. And even if you are going to failure, studies show that you're really still not getting the bone health benefits at that point, unless it's more high intensity, high impact.
Do you want to just explain failure? I guess we should have talked about that earlier, but when you say failure, what exactly do you mean? Some people may not know that.
Sure. So you're going to your fatigue. So by that 10th repetition, you feel like you can't do another repetition with proper form. That would be you're going to failure. You're feeling that muscle burn by the end of your set.
And I think that's important because, a lot of people think, oh, well, I'll do 50 repetitions, but that's not what's been shown in the research to really be effective.
Exactly.
So what would you, if you have some last minute things? I'm just excited because this is possible for everybody. And, we just have to find the people who have backgrounds in osteoporosis, or even if you have, the other thing is someone, oftentimes if you have a problem with your knee or a weak knee, and that's not going to allow you to do a lot of the exercises. So this is something you could use orthopedically, go to a physical therapist, fix your, get your knee, and then you can also progress more with your exercises. So there's just so many applications. And I just think the fact that the research is coming up so positive and with bone markers is just, such a win-win. So if you
Yeah, it
had,
definitely seems, yeah,
no, I'm sorry, continue.
it definitely seems promising that the research is showing positive benefits with not only strength, but bone markers and bone mineral density in general.
Yeah. So anyone involved in a research institution or anything, we're just on the podcast putting it out there. And I just think it's exciting and just something to know that there are other things, it's not like you can't do these, can't reap the benefits of the high intensity by doing low intensity with the blood flow restriction. So just so exciting. So are there any last minute things that you'd like to share with everybody about osteoporosis, or any pearls that you want to let everybody know?
Yeah, I just think alignment is key. And if you want to learn more information, either go to your doctor or local physical therapy and get some more information. There's a lot to learn and things that you wouldn't even think about that are part of healthy bones and a healthy lifestyle. So definitely something to think about.
Yeah, I think that's such good information because, people could be sitting disaster and they're having all these other issues, and, they get this diagnosis. I always think of a diagnosis of osteoporosis or osteopenia. is a wake-up call, or an opportunity to sort of look at your life in all sorts of ways and make improvements that not only improve your bones, but improve everything. I mean, there were people in different classes that I was part of that were in their late 80s and they're exercising, they're moving chairs, they're doing incredible. And they started out as couch potatoes, but because they had to start embarking on an exercise program, and strength training is so empowering. When you are stronger, you just feel so good and you could conquer the world. And who doesn't want that? So if you can't get it through regular, then start with the bands, start with the cuffs and the blood flow restrictions. So anyway, thank you. It's been such a pleasure. And I really appreciate all your information, and please stay in touch. So if you hear new research or anything going on, and I'll have your information in the show notes. So if anybody lives in New Jersey, they can work with you, because you work in the, you actually work in a facility that does all these things. So all New Jersey people, there's an option here.
Thank you so much for having me, Margie. It was a lot of fun. Pleasure being here.
Oh, well, thanks so much. It's just been great. I hope you enjoyed my interview with Gina and now learned what blood flow restriction training is, also known as BFR, and it may be something that could really be helpful. Again, this is new, using this for osteoporosis, and I know more research is on its way, but I just wanted to tell everybody about it because I think it's exciting, and I think it gives us another tool, especially for those people who can't do the kind of high intensity strength training that we really want for our bones. So I think it's exciting, and keep me updated. If people have information on this or you're doing it, please share it with me. And I just want this to get out there to the community because I just have a really good feeling about it. So I'll have all the links that Gina talked about in the show notes. And thank you so much for tuning in. And I look forward to seeing you on the next episode.